Introducing the African Diaspora News Channel app, your gateway to stories that's overlooked by the corporate mainstream media.
And we serve as the voice to the Truba Black community.
Again, we got Dr. Candace Matthews.
A lot of these documents, looking at.
We are committed to informing and educating through the power of media.
This country is supposed to be about the land of the free for all. It has not been free for Black people, and we are tired.
With our platform, we're helping to end injustice by exposing it.
Join us in standing for excellence in journalism and serving our community. Download the African Diaspora News app today.
Clinics in communities really need to do better. Hopefully there is change after this election. Hi everyone, my name is Inge Stoffels from Cape Town, South Africa. Now, the Cape Flats residents criticize poor service at clinics. This was a title of an article published in 2018. Ground Up also reported in 2015 of the struggles people had accessing public healthcare facilities. Now let's focus on that word access. Having access to healthcare is a basic need. We do not decide when we get sick. We do not decide when it is severe. Now, Pinky Mapaza complained about the Nyanga Community Clinic. She said, we wait outside in long queues from 5 a.m. We get mugged sometimes while waiting for the clinic to open, and when the staff finally come at 8 a.m., they still do not open. We have to wait until they've had their coffee or tea and are ready to open for us. Now, that was an extract from the article in 2018. And yesterday, June 2024, I received a voice note in a group from a community member. And she was speaking about how the community had complained when now it is June, we are in winter. There are people waiting at 5 a.m. in lines outside of a clinic in the rain. So our people have said, okay, fine, we understand if the clinic isn't open, but at least give us a roof or a shelter or a place we can wait, because now we are waiting for hours in the rain for a clinic to open up. There are also no emergency services available at this clinic or day hospitals. It closes at a certain time. And yes, we can blame the government for this and that. There are many people we can blame for it. But this is happening in gangster-infested areas. People are scared to stay beyond working hours. Doctors, nurses, they are scared to stay late hours. As people are also saying, when they are waiting those early hours of the morning, they are getting mugged. So it is unsafe for them to be there, but where else do you go when you do not have a vehicle to take you to the nearest hospital? So you are at the clinic, you are at the day hospital, you are at the community clinic and the day hospital that's closest to you. And this is the service that you get. This is the quality that you get. So now, with the voice note also sent yesterday, the people of Mitchell's Plain were complaining about how they were waiting outside in the rain. And this community member, Auntie Nessa, she also said that they complained. They complained about what was happening. And today, that was on Wednesday. And today, it is sorted. Then she went on to send a voice note where she says, and she says this in Afrikaans, but I'm going to say it in English. She says, us brown people don't complain enough. We complain to our neighbor, we complain to our friends, but we are not complaining to the right people. She also mentions that in the white areas, they love to complain. They complain about every little thing in their area. And that's how it gets done. So a statement that she made is we need to start complaining to the right people, because we are also people. We also have needs. We also deserve a good quality of healthcare, a good quality of life. And yes, we live in the communities where people are scared to come. Yes, we live in a community where there are different factors that come into play, when it comes to healthcare and doctors and people coming out into these areas, there is a whole mindset, or there is this whole fear factor where people are scared to come into the area alone, or they are scared to come into the area without someone that knows the area, or without someone that lives in that area. So that is just another issue that is happening in the communities, and I'm not going to stop speaking for the community because something needs to be done. So let us know your thoughts on this issue. People waiting 5 a.m. outside of the clinic because the clinic doesn't open until 8. Understandable, but it is unsafe. It is winter. What can be done about this issue? Let us know your thoughts in the comment section.